We're going to turn again now to Dr. Jen Ashton here for more answers to your coronavirus questions. We've got some great ones that are coming in from our viewers, Dr. Jen. We're going to start with the first one. Is there any correlation between blood type and whether or not you get the virus or how sick you become?
That's a really interesting question. There was a limited study done very early on in this outbreak that showed that people who had type A blood were significantly at greater risk of getting sick with COVID-19 than people who had type O blood, who were less likely. Now, it definitely needs more research. It hasn't been peer reviewed, but if there is any truth to it, it does have implications for healthcare workers. It's not really for the lay public, but in terms of stratifying risk of healthcare workers, it may be useful, but really inconclusive right now.
All right, our second question, this is a good one. Does the virus migrate once it's on the skin? The warning is to keep your hands away from your nose, mouth, and eyes, but what if you touch your cheek or your forehead?
So the virus doesn't crawl, okay, like some parasites do. But again, let's say it's on your cheek and you just brush your hand over your cheek and then 2 seconds later you touch your eye or your nose or your mouth. That's how you can get infected. So again, the contact transmission, the hand washing is really, really important.
Yeah, once it's on your face, it's easy to move it to a place where it could then be, virulent. All right. Here's our third question.
Exactly.
Does the latest pneumonia vaccination for seniors help with symptoms?
Well, that Pneumovax vaccine, which is for pneumococcal pneumonia, is really important for people over the age of 65. However, that does not protect you against this novel coronavirus. What it may do is lower your risk of getting pneumonia from multiple pathogens. Remember, people who go to the hospital sick with pneumonia, they can have more than one type of pneumonia. We hear that with the flu. You can have a viral pneumonia, then with a superimposed bacterial pneumonia. So not a direct protection, but still important nevertheless.
All right, and Jen, we've been talking over the past few days about the nationwide blood shortage and encouraging people that it's still safe to donate. But this next question is interesting. Are people giving blood, they ask, required to have a COVID-19 test and await those results before donating?
They're not, but the American Red Cross is taking really, really aggressive additional steps right now in the setting of the pandemic. So they are checking people's temperatures. There's no evidence that this COVID-19 or novel coronavirus can be transmitted via blood, but they're taking a lot of extra precautions, and we desperately need more blood donations. So people, if they're interested, can go online, see what testing center is near them, and register online.
All right, that is great advice. Now, I was just talking about this because this time of year, so many of us have allergies. And so our next question is, and I get them every year seasonally and right about this time of year. So our next question is, where we live, pollen and tree mold allergies are in full swing. How can you tell if sneezing, coughing, and sore throat are just allergies versus a case of COVID-19?
The first thing is, Amy, no one knows you better than you. So if something feels bizarre to you, that's when your radar index of suspicion should go up. You should start, paying attention maybe a little more closely. The other thing is that COVID-19 really has such a massive range of symptoms. Many people have such mild symptoms, they may have no symptoms, so they don't know they're infected. The classic ones are easy to spot. Fever, cough, fatigue, some chest pain if it's severe in terms of respiratory issues. But the other common cold or allergy-like symptoms, people can have those too. And that's why it all circles back to testing. We need to be able to test so many people so we can get a grip. Because remember, you can have two things at the same time. You can have allergies and you can have coronavirus.
Right. And I'm just curious, do we even know the answer to this? Why is it so different from person to person? Is that how most viruses act and react differently from human to human?
We don't know because, again, there's so much about this virus that we're still learning. It's not even really 3 months old yet. But in general, we even see that with influenza. Not everyone gets massively ill and bedridden for 7 to 10 days with flu. Some people have more mild symptoms. So there's always a spectrum. We call it a phenotype of a virus. And we're seeing a huge one with this one for sure.
All right. And speaking of tests, our next question surrounds that. Do the tests have to be taken up your nose, or are there other ways?
The good news is that there are other ways that we will be seeing very, very soon, in days to weeks. But right now, the only test that's widely in circulation is a nasal swab. And Amy, it needs to go all the way back there. So it's pretty uncomfortable. But you're going to be seeing self-swabbing in the nose. Sometimes in the hospital, they do an oral pharyngeal swab down the throat, which always causes people to cough and gag. But we're going to be seeing finger pricks and eventually blood tests for serology to see if we have antibodies against this. So we're going to be seeing a lot of options in the realm of testing.
All right, over the next coming weeks?
Hopefully, as soon as the FDA approves these other methods, we need to see them, as we say in medicine, stat.
All right, Dr. Jen, as always, thank you so much. And if you have your questions for Dr. Ashton, you can send them to her Instagram at Dr. J. Ashton.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.